Right. Good evening, everyone. Welcome to today's Fireside chat. I'm seeing we have quite a number of participants who has joined, so I believe we can kickstart the webinar for today. My name is Dr. Yuri, and I'll be the moderator for this session. And today we're going to have our 199th Fireside chat. We are just one Fireside chat from hitting the 200 milestone, so we should be celebrating soon. And today we are looking at an interesting topic. And the topic of the day is people, purpose, and progress in kidney care, looking at centering the S in ESG. And our guest speaker for this talk is other than Agnes Kimaru. She's been our speaker before on Matters ESG. And a little bit about Agnes is that she is a seasoned ESG and QHSE leader with over a decade of experience shaping sustainability, compliance, and impact strategies across sub-Saharan Africa. As an ESG senior manager at Africa Healthcare Network, she leads environmental and social governance initiatives in Kenya, Tanzania, Rwanda, and Zambia. Her career spans healthcare, manufacturing, aviation, and packaging, where she has championed renewable energy solutions, risk management frameworks, environmental initiatives, and social impact programs that align profitability with purpose. Throughout her career, Agnes has collaborated with global investors, regulators, and stakeholders to ensure strong ESG performance and transparent reporting. She holds a Bachelor's of Laws from the University of Nairobi and has completed advanced training in ESG, climate change, sustainability, and occupational health and safety. She is a 2023 KENCTAD ESG Award nominee, and Agnes is committed to building resilient, responsible organizations that deliver both business value and sustainable impact. So looking to a very insightful talk on the S. So over to you, Agnes.
All right. Thank you so much, Dr. Yuri, for that lovely introduction. I think sometimes it's normally interesting to hear your profile so that you can see where you need to keep going and just keep developing yourself as a person. So I hope I'm audible. If I'm not, Dr. Yuri, I'll be requesting your assistance to just flag me. And thank you to everyone who has made time to be with us today. This talk is about people, purpose, and progress in kidney care, and we'll be centering the S in ESG. So I know most times when we're in the boardrooms, we hear about you hear about the environmental issues of a company, you hear about the governance issues of a company. But today we will be zooming in on the S, which is the social dimension under ESG. And that is mainly because in kidney care, people aren't just the stakeholders. They are the reason we exist, and more so as professionals in healthcare. So the first section is going to be on humanizing kidney care. And that's, for me, the most important part. So we are humanizing kidney care, which means that we are going beyond seeing just a diagnosis. We are recognizing the experiences of our patients. We are also looking at the disparities that are there in the healthcare system. And we are also looking at how we can design care that is compassionate, that is inclusive, and that is person-centered. So that's what we are about to dive into. And I hope that we are going to have an enjoyable session. So let's start off by understanding what is ESG and why it matters in healthcare. So this is kind of like a recap from our last session where we had an overview of what ESG is. And ESG stands for environmental, social, and governance. And this is basically a framework that enables organizations to gauge their ethics, to gauge their sustainability, performance, and to just be able to run things in accordance with the international frameworks. So in healthcare, ESG also helps us to assess how well our institutions, basically like our centers, are caring for people. It helps us protect the environment by fostering environmental conservation initiatives, and it also ensures that we uphold ethical leadership. So that is it in a nutshell. And today, as mentioned, we are going to just take a bit of a deeper dive into the social pillar. And for the social pillar, we are going to be looking at patient equity and access. We'll be looking at workforce well-being. This is how happy are your healthcare professionals, that's the nephrologists, the nurses, even the support staff like the cleaners and gardeners and the like. We'll be looking at community engagement. How are our activities impacting the community? We're also going to be looking at how healthcare outcomes are sometimes influenced by social determinants. So I think the key thing here is the people, and that's what we are going to be looking at. So just as a note, kidney care offers a powerful lens to examine the S, which is the social, because it touches lives across the clinical, the emotional, and the societal dimensions. All right, so now let's look at the people part. So who are the people behind kidney care? The short answer is that it is all of us who are on this call, and it's the patients, and they're the ones who have the largest part of with regards to impact. And you can see on the right there, we've tried to rank the kidney care roles in order of patient impact. So the patients are the ones who experience the hardships, they're the ones who need access, and they're the ones who are often faced with lifelong treatment, whereby if you have CKD, that means that you are on dialysis till the very end. You will be faced with possible emotional strain and financial hardship. Don't get scared by that harsh truth, but what we are saying is that these are all things that can be made more comfortable for our patients. And especially because a lot of these come about and are coupled up with social factors like income. Is a patient able to pay for their treatment? Education, do they have enough information about their disease? Geographical issues, can they access care or do they live too far from the nearest dialysis clinic? And those are some of the factors that would affect access and outcomes. When we look at the healthcare professionals, they face a high rate of burnout and what we call compassionate fatigue. And this is as a result of the long hours, as a result of being at the face of what the patients are going through. And in such cases, it's important that we provide mental health support for them because it's a lot to deal with. And sometimes the patient on the bed, on the dialysis bed, can be a relative, can be a friend, can be a teacher from your past. It can be someone close to you. And even when they're people you've just met, it still is a lot for you to take in. And that's why it's important to be able to balance this career with mental health support. When we look at the support teams, this is like the admin staff, the transport staff, the cleaning staff, and those in tech. They are very important, but in most cases, you find that they are being overlooked. Especially when you're looking at healthcare, like very rarely would you think healthcare and go support teams, but they're the ones who are oiling the wheel that keeps us going. And their duty is to essentially ensure operational success, and their well-being directly impacts the patient. So that means they are essential for kidney care. Think about a situation where we have a dirty dialysis clinic, and also think about a situation where we have an overflowing bin. There's already issues to do with infection prevention and control there, which can directly impact the patient. There are issues to do with occupational safety and health. For example, if you have a floor that is full of water puddles, a wet floor, it's very easy for a patient to slip and fall. So much as we find ourselves often overlooking the support teams, it's essential that we put in mind that they are very key players in ensuring good kidney care. So let's take a step to look at it from the perspective of the stakeholders that we've just mentioned and some of the realities that they go through. So let's look at the real voices on the ground. You're likely to hear something like, I travel 4 hours for dialysis 3 times a week. It's exhausting, but I have no closer option. That was a quote from a patient in rural Tanzania. You're also likely to hear something like, we are short-staffed again. I'm doing the work of 3 nurses today. That came from a renal nurse in a peri-urban hospital. That means it's a hospital that is not necessarily in an urban place and it's not necessarily in a rural place. It's a place right in the middle. A good example of that would be Kikuyu in Kenya, Kikuyu town in Kenya. You're also likely to hear something like, I clean the dialysis unit every day, yet I've never been trained on infection control. And when you think about it now from these voices, these are just a tip of the iceberg, and they are likely to bring about impact to the health outcomes that we face. And they're just a brief of what the visible health disparities are. So we have issues like geographical barriers, whereby sometimes the location of the hospital is too far and makes it very difficult for the patient to access healthcare. In some cases, you find our staff and even our support staff lack enough training, whereby just based on the fact that they are able to provide a skill, for example, cleaning, for example, just assisting with beddings and stuff like that, they are still not offered with advanced training that they would need for their day-to-day operations in the dialysis unit. So that's also another visible health disparity. Staffing shortages, which is common in the healthcare profession. You find that the healthcare workers are most of the times overworked because there are shortages in the workforce. And you find that they end up working very long hours. So going back to the point on burnout. Then we have social determinants. When we look at issues like housing, issues like education, issues like income, all these are critical to care and can end up being the reason why a patient has missed a dialysis session, the reason why a patient has been unable to go and collect medicine that they require, and would ideally affect the health outcomes. It's therefore very important that we take a step back and think in line with our stakeholders in healthcare. As mentioned earlier, let's think about the patient, let's think about the healthcare professional, let's think about the support staff, let's even take a step to think about the policymakers, the government, and the various bodies that support us, so that we can see how best we can plug into making sure that we are offering the best healthcare possible. When we look at purpose, we're going to be looking at reconnecting with the why we do this. So it's going to be kind of like a self-reflection module where we're going to just be trying to understand why we do what we do as healthcare professionals. So the first part we're going to look at is aligning values with social impact. And purpose is not just personal, it's organizational. So you as Dr. So-and-so could have your purpose, which is making sure that the patient feels well taken care of, taking care of the patient like they're your own family, but it needs to be organizational, because even if you have that drive within you, as long as you do not have the support of the organization as a whole, it becomes very difficult for you to meet your purpose. So how are we going to do this? How are we going to align our values with social impact? This is by enshrining our mission with measurable social outcomes. So by this, I mean offering very patient-centric services, making sure that all our decisions are transparent, giving the patients a voice. So for example, being able to have patient advocacy committees. You have various meetings within the corporate boardrooms. Once in a while, invite a patient over, get to hear from the patient. What has their experience been like? What can be better? What is working? And you'll be able to get a lot of insight that will ensure you offer patient-centric care. Also look at inclusivity. Make sure that the workplaces are inclusivity. I know we've had this word time and again, DEI. It's an abbreviation for diversity, equity, and inclusion. And it simply means making sure that everyone is catered for, regardless of their race, religion, abilities or disabilities, just lacking any form of discrimination in healthcare. And it can be something as simple as having ramps as opposed to stairs, or complementing one with the other, whereby even those who need to access the dialysis units with wheelchairs can be able to do so comfortably. Part of inclusivity also means looking at the people who are working. So just because someone has CKD, or just because someone has an illness, maybe I'll just say CKD is chronic kidney disease for anyone who might not be in the dialysis realm. So we're saying that having CKD doesn't mean that it's the end of your social well-being or your social life. Someone with CKD can comfortably still go to work. They can comfortably still go on with their normal activities. So it's important that even our schedules as clinics cater for this person, whereby you can be able to make sure that maybe you have a night shift that allows someone who works an 8 to 5 job to still attend their dialysis sessions without missing work the next day. I know in more advanced countries, they even have like a sort of hotel room structure whereby you receive dialysis and are able to sleep in the unit for the night. You get a place to have a shower, place to change, and then in the morning you just wake up and go to work. So that would essentially be the vision. But for now, just the little things we can be able to adjust to make sure that we are catering for all the patients, that we are being inclusive, would go a long way in increasing attendance, that is attending the sessions, and also patient satisfaction. It's also important that we advocate for the underserved populations, and the underserved populations here would essentially be the populations in the rural areas, as well as those who may not have access to the education to know that they need a particular form of healthcare. So it's important to be able to have community outreach programs where you can be able to give this education, and also where it is possible, when you are next building a clinic, look at those underserved populations, and you could be helping someone who travels for hundreds of kilometers seek care at a much closer point. So this is mostly a geographical issue. And now that we're saying we need to align our our values with social impact, we are going to just take a quick look at AHN's core values and see how AHN is walking the talk on this front. So one of our core values is patient first. This means that we put patients above all else, and it means that we are delivering compassionate, personalized, and industry-led care. So patient first for us is our bread and butter. Another core value is teamwork, meaning that we are collaborating every day. Remember, we said we need to look at all our staff, including even the support staff, the nephrologists, the nutritionists, every single person who is part of our organization. So working together, collaborating, where everyone's opinion counts and matters. We also have a core value of results driven, which means that we set bold ambitions and consistently deliver exceptional results. So as opposed to just doing things and recording that we've done something, it's to set a target, make sure it has been achieved, and even like take time to analyze the results. Another one that I'm particularly passionate about is community. Here we are looking at being dedicated to being a force for good in our local communities. So this is extending our impact to the local community, which is very important because when you have built a clinic in an underserved population, of course, you have brought a glimmer of hope there. They are looking at you for the possibility of jobs. They are looking at you for the possibility of better access to care, possibility of affordability. So being a force for good and being a beacon in the community is one of the core values at AHN. Innovation, another core value, whereby we're saying we are committed to continuous improvement, seeking creative ways to improve our work. At the same time, as we are looking at innovation, we are also key to note that not everyone has access to internet, not everyone has access to technology. So how do we move along with them as we continue to improve continually, as we continue to be innovative? Last but not least, integrity. We had spoken about ethics earlier. It's important that everything we do is done ethically and that it is part of who we are. It is enshrined in our existence. So that was just a brief look at how we can align our values with social impact. And I feel like AHN does that quite well, and they've managed to showcase this with their core values. Next, I'm going to be showing you a picture that I quite like. And this is an image from AHN Tanzania, whereby they were able to have a mural done in one of the dialysis units. You can imagine a patient is there for quite a long time, every so often. So I know like in Kenya, the dialysis sessions are twice a week. In Tanzania and Rwanda, it's thrice a week. So you can imagine being there in the dialysis unit for hours and hours, and you want to make sure that the patient does not feel gloomy. Of course, no one wants to be on dialysis, but needs must. And it's usually very uplifting to get into a room that is well decorated, a room that is warm, and that gives you a comforting atmosphere. So we were very proud of one of the centers at AHN Tanzania being able to do that using this mural. So there are various ways you can think of how to make the patient experience better. Remember, we said social impact is just thinking about the people. So think about that patient. Yes, you're offering the best care. Yes, you're making sure they are not missing their sessions by calling them to tell them that they are due for their next session. But when they're actually there with you, how are you making sure that they feel comforted, that they feel welcome, that they are satisfied with the environment? So this is one way of doing it. I know I did not want to delve deep into this, but I can just also mention as another example. You can also celebrate the patient's birthday. Of course, when you are doing the patient registration, you get their biodata, and it's important to even just have a brief conversation as you get to know the patient. I know in the um, other side of the world in marketing, they call it knowing your customer. So now we are knowing our patient when it comes to healthcare. Know their birthdays. There's nothing stopping you from wishing the patient happy birthday on their birthdays. But remember, we talked about inclusivity. There are some instances where some patients just don't want to celebrate birthdays. So it's important that as you get to know your patient, you get to know whether they are okay with celebrating their birthdays or whether they would prefer to just have it kept silent. So a small cake, a small gift, yeah, just ways to make them feel comforted and make them feel uplifted. Okay, next we're going to look at how we can empower our teams to thrive. So teams here, we mean the healthcare professionals and the support staff. So there are so many ways you can do this, and this is one thing we need to note about this is that healthy staff brings about happy staff brings about happy patients. So it's important that we make sure our staff are happy and that they are taken care of within all the areas possible. So one way would be to recognize their contributions, just a simple thank you. Tell them that you are happy with what they are doing and be able to spotlight people who have gone above and beyond. Offering career development, whereby, of course, there's the CNE programs, whereby there's continued education for the nurses and other healthcare professionals. But it goes beyond that. You could sponsor conferences for them. There are so many conferences that take place throughout the year, some of them within the countries and some of them abroad. It would be good for us to just, whenever possible, offer career development that goes beyond the geographical borders. It's also important that we gather feedback. So go back to the ground, find out, are they comfortable? Is anything the problem? And sometimes you'll find that it's something so small. Like you can find an instance where maybe a locker room door is broken that needs fixing, but it's causing a lot of discomfort within the center. And by getting feedback, you're able to know that there's a problem somewhere and it's fixed quickly enough for it to stop bothering everyone. And feedback goes a lot of ways. It can be face-to-face feedback, whereby the staff can come to a designated member of leadership like HR, or even just a center head, and say they have X problem and they propose Y solution. It can also be anonymous. So it's important that an organization provides anonymous feedback platforms. So you can have an anonymous link, which you can generate using softwares like Qualtrics. And you can always work with your IT department to devise an anonymous feedback model, whereby staff can be able to write their grievances, they can be able to provide feedback or areas where they would want something improved. And once it's analyzed, it's possible to address it. You can also launch wellness programs. So that would be a way of catering for the mental health aspect, which we talked about, that healthcare professionals go through a lot of burnout, they go through a lot of fatigue. So some of the things I know that have worked would be the possibility of offering gym membership to the staff. Of course, where possible, if you have like a gym near the facility or within the facility, in some cases, you can offer them access to the gym. You can also offer them access to therapy. I know at AHN we had featured the use of RAFI, RAFI, which is an app that you use to seek remote therapy. And it had been made accessible as a pilot project to our corporate staff to just be able to access therapy sessions when needed. You can also implement peer support, whereby people can have various support clubs, which can either be pegged on common interests or pegged on just the geographical part of, and this can enable them to support each other, because your colleague is the one who shares the same issues that you are going through. They're also with you there every day. So it's always nice to have someone you can speak to about what's going on. And other ways you can be able to recognize your employees can be through various initiatives. I'll be taking you through the ones that we're currently running at AHN. So we have Core Value Champions Awards, and these are awards for people who have best manifested the core values within the organization. So the core values that I've taken you through, if someone has really showcased being patient first, we offer a quarterly award whereby the staff nominate their fellow peers, and after evaluation by a committee, then they're awarded and recognized. You can also have long service awards. This is for your staff who have been in your organization for a long time. Maybe when they meet the 5th-year mark, when they get to 10 years, it's something that you can discuss internally and decipher, or rather decide when you would want to award long-serving employees. I know we also have wellness programs whereby we offer gym membership to staff, especially in the corporate office, because there's a gym in the same building, and also access to therapy through the app I just mentioned, Rafi. There's also a lot of advocacy for employee feedback, where I know the HR department every so often will send through a survey to get to understand the employee satisfaction levels, and just to get to understand what employees are experiencing. So this normally is done, and the data is analyzed, and they create an action plan whereby they also share it very transparently with the staff to say, this is the feedback we received, this is the action plan. So that kind of transparency breeds accountability and ensures that the things that we have promised to do, or rather that have been flagged as required to be done, are actually done. And something as simple as thank you cards, whereby you give your employees a card to just say thank you. It can be done during the Nurses Week. It can be done during various celebrations to just tell them, we see you and we appreciate you, and we are grateful for what you're doing. You can also celebrate the birthdays. I know you are seeing some of the images that I had just picked up from some of the things we do at the office, and at the organization as a whole. You can celebrate birthdays. This can be as simple as having a cake, having peers appreciate and celebrate those who have been born in particular months. You can do August babies, for example, towards the end of the month. You can also ensure that you have your staff attending various conferences. This will enable them to continue getting education in the healthcare profession, and also to just give them room for networking with other healthcare professionals. So conferences are a good way to do that. Also the marathons. I know in Kenya, the Stanchart Marathon is coming up in October. So that's something to look forward to. And of course, in such events, you're able to meet with so many other professionals, and it's a good way for the staff to be networking. You can have a team building session whereby the staff meet, they can do some form of physical activity, and then they can also share a meal. And it's always good to have these team building activities, because sometimes maybe there's that one person in the organization, maybe you just see their emails, but you've probably not seen them for months. But during that team building event, you're able to see a lot of your colleagues and even just create and grow the bond. Another interesting one is the office potluck, whereby everyone makes a meal from home and brings it to the workplace, and we share the different meals with each other and experience the different cultures, the different modes of cooking, because maybe the way I cook my rice is not how someone else cooks their rice, but it's always important to, and especially in the African sense, to share a meal and just breed that sense of togetherness. So those are just some of the images of few things that you can do to empower your teams so that they can thrive. The next segment will be on progress, and this is embedding the S in practice. So we'll be looking at the social metrics that matter. If you treasure it, measure it. That is one of the key principles in ESG. And this means anything you treasure should be measured, be it your water consumption, be it your electricity that you're using. Anything you measure needs to be treasured. So even the patient outcomes that we are really relying on, we need to make sure that we measure this. So we need to move away from the traditional metrics, because the traditional metrics will probably have a huge focus on clinical outcomes. They will have a limited scope as opposed to having a holistic outcome focus. You will find that they are reactive impact measurement tools, whereby you are dealing with something that had gone wrong, as opposed to preempting what can go wrong through ensuring proactive measurement. And maybe just to give a bit of depth to this. So we need to look at things like patient outcomes, looking at the dialysis quality index, DQI scores, which are normally pegged on patient safety and quality of care, looking at health equity and access stats, looking at the affordability of the care that you're providing. Can everyone afford it? Are you in a position to offer free sessions to those who are underserved? Are you in a position to offer EPO or iron or any of the supplements that they would require for those who are, again, underserved? And is everyone is everyone going for the sessions that they have been booked for, or are others missing sessions? If they're missing these sessions, what are we doing about it? You can also look at the percentage of underserved patients that you have served. These are good stats for you to be able to measure your social impact. You can also look at the percentage of centers that you have built in rural areas, because those are the people who would ideally struggle with access to care. So being able to track how you're making care affordable, how you're making care accessible, and how you're ensuring that you're offering patient safety and quality care would be a key metric. Another key metric is employee satisfaction scores. I know we've already discussed this briefly. So you can have feedback surveys and have the HR teams analyze the data from the surveys, you can look at your net promoter scores and be able to make informed decisions as a result of this. You can also look at things like employee occupational safety and health statistics. How many injuries have you had in the workplace? How many incidents have you had in the workplace? This can also be a metric that can help you know how you're performing socially. You can also look at the community impacts. So how many community outreach programs have you had? You can also look at an interesting one, which would be how many members of the community have you employed? Like how many locals you have as opposed to expatriates type of thing. And these metrics are going to help you ensure that you are tracking things that are more aligned to the ESG requirements and will enable you to make informed decisions as you continue planning for the future of your facility or your organization. So we've talked about community impact, and I have a picture in the next slide, just showing what AHN Kenya was able to do earlier in the year. So on the left there, you can see some of my colleagues at the in Westlands rather, collecting trash on the streets of Westlands, and that is near the AHN Kenya headquarters. We also collected clothes and toys, which we meant to donate to a local charity. So it's important that you partner with the local communities to ensure that you collaborate with them towards better social impact, or rather positive social impact. Another thing I wanted to tackle would be innovation with inclusion. And this is looking at how we can use technology to serve our patients better. But as we do this, I think I'd mentioned this when we were starting, it's important that we are mindful that not all our patients have smartphones and not all our patients have internet. So as you continue to innovate, as you continue to use technology to expand care, I know there's various initiatives like telehealth for remote patients, whereby a patient can dial in and be able to get some form of consultation from a nephrologist or from a nutritionist or a healthcare professional generally. I know these days, and I know we all do it, we are all using ChatGPT, we are using Copilot and various AI tools, and we tend to self-medicate. You get in, you say, oh, my back is aching, oh, you even start diagnosing your kidney, even if you don't know where it is. These are some of the things that are happening in the current world. But it's important that as we continue to innovate, we remain cognizant of the fact that not everyone is moving as fast as we are. So even as you use technology, have models to ensure that you can be able to cater for those who don't have access to technology. But notwithstanding, I'll still cover some of the softwares, or rather some of the things that we are doing that are making things a whole lot easier for health professionals. So we use softwares like Clinicia, and you can use Clinicia to schedule sessions, you use it to register patients, you use it to monitor your patient's health, and also use it for billing. So by doing this, you can be able to analyze the data that you collect and be able to reach out and identify patients who are in need of CKD treatment. CKD, we said, was chronic kidney disease. And you can even retain a CKD registry. And this can be done through analyzing even some of the lab results that you receive as the patient is getting onboarded into your clinic, whereby maybe someone has high levels of urea, which would ideally mean that they are at risk of being CKD patient. And it's just using this kind of technology to preempt and to be proactive about kidney care. So let's use this technology to our advantage, but I'm still advocating that we ensure we are very mindful of those who do not have access to technology. So let's balance the technology promise with equity so that we don't leave others behind and end up facing the challenges of the digital divide. Okay. as we near the finish, it's important to scale social impact beyond the clinic. So look at various ways how you can do this. One of the ways would be local partnerships. So strengthening the community ties and resource sharing. So I'd already shown you an image of AHN Kenya doing that. They had partnered with the Nairobi City Council to conduct a cleanup exercise. And that helps the community at large and also builds partnership with bodies that are stakeholders to the healthcare profession. Outreach programs are also important to ensure we have community education, whereby you can have a health talk, you can have a medical camp, whereby you speak to people about kidney care and at the same time conduct screening to ensure that those who are at risk are also reached early enough and can be able to get the help they need with the guidance from those conducting the medical camp. It's also important to partner with the local leaders because at the end of the day, they are the ones to go and come up with policies which will likely address the social determinants. So as we continue to embrace social impact in healthcare, it's important that we scale our social impact. So those are some of the ways we can be able to do that. And now we're just going to take a second I'm trying to make sure that I still leave room for a Q&A if anyone has a question, but we'll just take a second to self-reflect. So as you are behind your screen, reflect on your role, reflect on your role as a healthcare professional, because ideally you're the one who co-designs the patient's care. Reflect on your role as a support team member. Be you a cleaner, be you a nurse assistant, be you just even an IT person, a HR, just reflect on your role. As a manager, you're the one who will be in the boardroom making decisions about staff wellness and equity, making sure that you are empowering your teams to thrive. And ask yourself, what is one change you can make this month or just generally in your role to improve social impact? And once you do that, you'll be able to term yourself an advocate of social impact. And I hope you'll be able to walk the talk. And yeah, as I conclude, please remember that we need to humanize kidney care. We need to prioritize human aspects in kidney care practices because we have said people are at the center of it all, be they patients, be they the healthcare professionals, be they the support staff, be they local leaders or members of the government, be they investors. At the end of the day, it's all about the people. Hence, it's important that we humanize kidney care. Reconnect with your purpose. We've just taken a second to reflect on why we do what we do. Renew your commitment as an individual and also as an organization. Renew your commitment to the core purpose of kidney care, which is ideally to reduce suffering. If you ask a healthcare professional, why do you do what you do? I think the most common answer you get is to reduce suffering. So reconnect with your purpose as an individual and recommit to your purpose. Then embed progress. Integrate the social elements that we have talked about into kidney care progress. So think about those who are underserved, those who cannot afford care, those who cannot access care for one reason or another. And by doing that, you'll be able to make better decisions that are people-centric and that ensure very good kidney care overall. All right. So that's pretty much what I had for you today. I did not want to bombard you with too much. I know the social pillar is a bit lighter than our last webinar, which was more in-depth about ESG. So yeah, if there are any questions, I'm happy to take them now. Dr. Yuri, back to you.
Yeah, thank you, Agnes. That was quite an insightful talk. And I think it's a big challenge to us as healthcare professionals. Yes, first we need to humanize care. And because most of us think about the physical disease by, as you mentioned, trying to alleviate suffering. But I think, as they say, you cannot separate physical health from mental health, and in this regard, from social well-being. I think we need to incorporate that so that it's holistic and patient-centric. So thank you. I think I've seen Dr. Narindra, who was also given the certificate for being very socially centered. As we celebrate him, I think he has a question. So I'll give him I think a chance to speak. Let me see if I can give him.
So there's a question. Is there a measurable impact of transportational insecurity on missed dialysis sessions and subsequent hospitalization rates? So I know transportation insecurity is a big concern, and one of the ways to remedy this is through transportation kitties, whereby, again, as you continue to know your patient, you are able to know who is underserved or who would have maybe financial challenges with regards to getting transport towards to the center where they'll receive dialysis. And of course, we know if you miss a dialysis session, the outcome definitely is not the best. And you're always advised to not miss a session. And I just want to commend those who go a step further to call the patient. When you see a patient has missed a session, we've said we are going to be very people-centered, very patient-centric. So call the patient, find out why did you miss the session? What were the challenges? If you don't get dialysis in good enough time, these are some of the repercussions, and we need to avoid that. How can we help you get the care that you need? And subsequently, we'll be able to reduce hospitalization rates whereby a patient comes in for dialysis but ends up in the ICU for one complication or another. So I don't know if that helps, but yeah, ideally, let's look at it from the angle of how can we remedy the problem? If the problem is the transport insecurity, how can we remedy that?
Thank you for that, Agnes. I think there's a follow-up question still from Dr. Amar. On the same breath, I think he asked, the question is on what role does health literacy play in patient empowerment and perceived control over their dialysis journey? I think that's his second question.
Okay. So health literacy means, if you don't get dialysis, you're going to endanger yourself, dying. And that means knowing when and how to get the care and how frequently you need to get the care. So I feel that if you understand this in depth, you are likely to make your dialysis journey a whole lot easier, even for your caregivers, for your family members, and those around you, and even for the healthcare professional, because you can imagine a patient who knows the importance of going for dialysis versus one who doesn't know the importance, because you'll have one who is always there for the session and another one who you have to keep following up on and calling and trying to convince. So we are also in a society where we are likely to have common myths and misconceptions. So with this lack of literacy comes those myths and misconceptions. And it's important that we provide adequate education to our patients and the community at large to avoid them relying so heavily on the myths and misconceptions to a point where it could even lead to loss of life. And of course, we have said we are trying to alleviate suffering. And if someone is not getting dialysis, of course, they would be suffering. So I think for me, that's how it would empower the patient to have a much better dialysis journey.
Thank you for that response. I think in the same breath, Dr. Amar has asked about cultural beliefs, on how do cultural beliefs, I think it's a bit lengthy. Let me say, how do cultural beliefs and about illness and treatment affect patient preferences for dialysis modalities or transplant options? So he explains that he lost a dialysis patient this weekend who was opting for a native medication and also misleading other patients to pursue that particular route. before the patient's untimely death that no doubt may have sent shockwaves among his fellow patients.
Okay.
I think
So
there's,
sorry
yeah.
to hear about that, Dr. Amar. That's indeed very sad, but it's important that we employ a holistic approach as we provide kidney care. So let's not just look at it from the clinical outcome with regards to how the DQI score is. You can look at aspects like nutrition, look at aspects like mental health, because even over and above a patient misleading someone, sometimes you end up endangering other people in the ward or in the renal unit, whereby you find maybe a patient is fighting with the nurse, or maybe a patient has caused harm to another patient. So it goes over and above just offering the treatment, and we need to also focus on it holistically. Look at nutrition, look at psychological care, look at palliative care. And this way you'll be able to be more proactive and preempt such incidents whereby even if something like this is happening, the other patients are well educated about kidney care, and they know what is true from what is a myth, and you can be able to tackle that slightly better. I know it's not an easy thing, but with time, you'll end up victorious. It's just persistence. Keep trying, and you'll finally succeed. So just look at it holistically.
Thank you for that response. I think there are two more questions. One from an anonymous attendee. The question is on, given the increasing number of patients who are wheelchair dependent, for example, at CRH, and the fact that nurses and other center staff are often required to carry them to bed, what initiatives are being taken to assist staff in lifting heavy weights and preventing back injuries, particularly among nurses? A quick example is on OSHA trainings. I think it's something to do with occupational safety and health. Yeah.
Okay, so of course there's the infrastructural bit, which is having ramps to enable safe transportation of the patient. Because the last thing you want is a situation where you are ferrying a patient from, say, an ambulance or their personal vehicle into the renal unit, and they topple over from the stretcher or even as they just walk into the unit. So the first bit would be the infrastructural part, which would be ramps. The second bit is on, of course, occupational safety and health training, whereby the staff are empowered about ergonomical issues, which are issues like musculoskeletal diseases, which come about from poor lifting and poor posture. And also back pain is one of the musculoskeletal disorders. So such kind of training coupled up with infrastructural changes or developments can be able to resolve this. And hopefully that answers it.
Thank you, Agnes. I think I can just add on to that because I think the concern there was the staff who are lifting the patients. I know there are patients who are pretty heavy, even if they're wheelchair dependent, and you have to assist the patient, and sometimes you are even the relatives usually come in. And I think there's a case where I remember a staff fell in the process of assisting a patient. As Agnes mentioned, I think also investing in equipments, there are hoists that are usually there, both manual hoists that can actually hoist the patient up to the bed, and there are also electronic ones that I've seen really working well. I think that's another thing that we can look at in such cases. But thank you for that response. Now another question, last one is on patient fatigue, depression and anxiety. Someone says this is very common in most patients on chronic hemodialysis. There is a role to consider psychiatrist in our patient care. I think it's a bit different from your talk. I think it's going mostly into mental health, but maybe you can just give it a try, Agnes.
Okay, so I know Dr. Yuri, you are the one who's championing this for us. I'll just maybe just
Yes.
open up the floor to you and just say that, of course, looking at patient mental health is very, very important because you could be protecting their caregivers, the fellow patients, and also the healthcare professionals. So I'll just let you handle that more in depth. please?
Yes, thank you, Agnes. I think the truth is on CKD patients, there is a lot of both physical and mental changes, or let me call them psychological changes, and also physiological changes that happen because of CKD. Some are endocrine based, so issues to do with hormones can cause a lot of fatigue, lead to depression. There's a lot of morphological body changes where patients feel either they are getting disfigured in certain ways because they're having accesses all over. So that also impacts on their mental health. There are issues of finances because a dialysis patient has to spend money to come and dialyze either twice or three times a week. They have to look for medication, money again to buy medications for other comorbidities like hypertension, diabetes, and of course, they say there's a correlation between finances and also mental health. When they are spending all their money on their health, there's also things that patients can't do because they can't eat what they used to eat. They can't attend social gatherings without thinking of probably where they're going to dialyze, so they can't travel far distances. So there are a lot of things to do with mental fatigue, depression, anxiety. And internally as HN, we have a program called Kidney Supportive Care program where the teams go around, they identify patients in need of additional support, both mental and also have discussions with them. And we also have patient support groups for that. But I think it's also good to loop in psychologists and psychiatrists, as the question says. But it's food for thought. Thank you for that question. I
Yeah,
think I'll
thank you
give
for that,
Dr.
Dr. Yuri.
Thank you. Thank you. I'll give Dr. Narendra a chance. Dr. Narendra, you can unmute.
Yeah. Do you hear me?
Yes, yes, loud and clear.
Okay. Nice. Now, let me first of all congratulate Agnes for a good presentation. And I
Thank you,
think
Dr. Narendra.
it has, this clinical and medical jargon people always sit and listen to. Of course, it is important. But I think it has been also important to look at the other way, the other requirements that we need to look into when we are dealing with patients, dealing with patients on dialysis. Now, maybe let me begin with a question to Dr. Yuri. I mean, there is this, the dialysis, it seems to be something new compared to the rest of medical practice that has been on, so that you find especially these people who have grown up, especially through administrative process, and they end up administrators in the Ministry of Health. And, they end up taking decisions when they haven't even gone through the training on dialysis and kidney care that we do in the modern times. And in fact, the issue of two dialysis sessions per week. When I was attending, Kenya Renal Association conference in Mombasa, this matter was raised. I thought, I had a feeling this was a decision of the NHIF, and I just wondered how, the clinicians actually, how they accepted it. It's just a question. I'm curious just to know. I mean, how did the doctors take it? Now, of course, NHIF, being just a financing agent, is it possible for patients to make their extra, the addition to that, so that they can pay for that extra dialysis that is required per week? Because this is just it's not a choice that we make. The 3 dialysis per week, it is necessary as supported by scientific data. So I think reducing to 3 sessions per week, it's like giving, the mandatory dialysis, the mandatory antibiotic dose of course of 5 days, and you give it for 2 days, then you have not treated. The course is not complete. So I just wondered why. what the doctors, especially in Kenya, what do they advise on that? Because the practice of 3 weeks, it is recommended by KDIGO, for instance, and it is based on scientific data. Now, okay, probably you is going to answer that, but I think going back to this holistic presentation you've had about care of patients who are on dialysis, this is just a comment I want to make. You know, I think it is everybody, be it clinicians, nurses, doctors, even everybody, administration, because quality particularly, especially in healthcare, it is system oriented. If things go wrong, maybe in administration or whatever, then things don't work. So the doctor, it is just like a flow and out. If there is a blockage somewhere, like the cleaners are not doing their job well, or now I don't like to, in Rwanda we don't call them cleaners, we call them infection control staff, to give them equal status to ourselves. We call them infection control staff, so that as we share this work, we at least we shared. I mean, we present a picture where we share sharing the credit equally, because without one is it the administrative staff, then things, if they're not doing their job well, the logistics stop, and you can't realize if you don't have the logistics. So it is something really that we consider very important, to share the credit, especially, and of course share the blame if things don't work. So I think it brought me back, in fact, even before I joined Makerere. I think this is the culture of the University of East Africa. The University of East Africa, I'm talking about the mother of the University of Makerere University, University of Nairobi, and the University of Dar es Salaam. We had a dean of the Faculty of Medicine, and they wanted to make more input so that the doctors, the medical students can live near the Mulago Hospital. Then the dean refused. He says, "Look, I don't want to produce doctors who can only read and write. I need doctors who can solve social problems." So I like this presentation because it addresses, especially being presented by a lawyer, and which touches very seriously on how we practice medicine. So thank you very much for whoever thought of this. That is, yes. I rest my case, but probably you can answer my question.
Thank you, Dr. Narendra. I think now I see why you are given the award for Value Champion for Community Centric. I think I can see the passion. But anyway, to delve into the question, I know, yes, we have the landscape. I can say the healthcare landscape in Kenya is a bit, of course, it's quite dynamic with a lot of players. I do take up the challenge. I think, as you said, 2 sessions a week is not enough, and we do agree. Because we even have the data on survival rates on CKD patients, 1 year survival rate, 2 year survival rate, or if you're having really fewer sessions, you find mortality rates are high, morbidity is high, and all that. I think it's a challenge for us as also healthcare practitioners not to shy away from leadership. I can say roles or opportunities where we can now sit up in the apex where major decisions are made, especially that affect the masses in a public. How I can put it is in a public health kind of sphere, because you can find that yes, up there we do have health economists or actuaries that sit and look at how much can the insurance pay out without and making profits and probably not going broke. And this needs, of course, to be guided also by healthcare practitioners who see the actual patients and also us have to lobby and also have patient representatives sitting in those board. It is not just the practitioners, but also have the patients sitting there, and also we get them to advocate for their rights. So yes, it's a challenge to us. We need to advocate more for our patients and also work with lobby groups if possible for patients and see how we can push that agenda so that we can also change, some of the thinking and the practices of the leadership of the different countries that we serve. But thank you for that. Maybe over to you, Agnes, for the second question.
Before the second question, I'd just like to acknowledge a comment from Dr. Valerie. She says this was a fantastic talk. So wonderful to hear the holistic approach, including well-being, mental and physical, of patients and staff. The daily experience and wisdom shared is palpable. So thank you so much for that, Dr. Valerie, and so touched that you could make time for this talk. Yeah.
For the second bit was not really a question from Dr. Narindo, but I think it was just an acknowledgement of the importance of also including other aspects in care from the social bit that we're having in the talk. And I think also looking at other areas apart from, just alleviating, disease and suffering. So thank you for that. Unless I missed a question there in the statement. I believe that was all the questions. I don't know whether we have anything else from the panelists. I think I saw Dr. Shu.
There was a
Do
question in the chat, and I think this
Yes.
is more your speed. How can we improve sodium levels in CKD? That's from John.
Oh, interesting one, although it's not aligned with the topic of the day. I believe we had one for both. I'm not sure whether they mean hyponatremia or it's hypernatremia, because with sodium it can go either way. We had a talk about, how to manage hyponatremia from one of our guest speakers, and I think also hypernatremia, we can do that. Probably I'll not delve into that because it's not the subject of the day. But I'll encourage John to just log into our YouTube page at Africa Healthcare Network. You can access all our webinars there. And if you just go back, you'll find quite a number of talks on sodium management. Thank you. All right. I don't know. I think Dr. Lloyd has probably jumped off. Yes, Dr. Jacqueline, you can unmute.
Yes, good evening, everyone.
Good evening.
It's just a comment that this was a very wonderful presentation. I think it's true that sometimes we are overtaken with the care of patients. For example, dialysis patient, what is the adequacy, how the anemia issues, and we forget the things that she's talked about. I think it's time that we should include those things, and maybe there should be people who are looking into it. For example, if the social workers and other people who can do this, maybe doctors may not be good in doing this because we will be overtaken by other things. But it's a good topic. Thank you very much.
Thank you for that feedback, Dr. Jacqueline. And again, thank you for making time to join us today.
Thank you. Thank you. I think we are 17 minutes past the hour. So if there's no other reactions or feedback, I just beg to close the talk. So a final thank you to Agnes for taking us through this enlightening topic. I think we've learned a lot on inclusivity. We've learned a lot on what has to do with centering the S in terms of social inclusion. And I think as we now leave and go back to see our patients, we'll not just think about the physical health, but also the social bits, also the mental bits, so that we give a more holistic care. So on behalf of the Africa Healthcare Network and our panelists, I want to say thank you to even our participants for joining and making this discussion very lively. It was quite engaging. And I do wish you a good evening and on to the next one. I think we'll meet on the next. Thank you.
Thank you, everyone, and have a lovely rest of the evening.